All right. Welcome, everyone, to our first fall session of the Empowering Every Voice webinar series. My name is Jennifer Snyder. I am the Student Success Program Manager at the SUNY Center for Professional Development. And I'd like to turn over our session to Cheryl Hamilton, the Associate Vice Chancellor of Student Life, Opportunity Programs, and Student Advocate.
Thank you so much, Jennifer, for that introduction, and welcome everyone. We are delighted to have you joining us today for the first Empowering Every Student Voice webinar for the fall semester. I'm so excited about today's presentation, which will focus on supporting students in recovery. And I'm so thrilled to introduce our speaker for today, Ashley Dickson, pronouns they, them. We are so thrilled to have Ashley as part of our SUNY community. Ashley is the Alcohol and Other Drug Prevention Coordinator at Tompkins Cortland Community College in Dryden, New York. They were pivotal in the creation of Collegiate Recovery Program, which was established in 2018, and they continue to help in the coordination of that program. Ashley found personal recovery from substance use in 2015, returning to Tompkins Cortland in the spring of 2016 to pursue her degree in chemical dependency counseling, over 10 years after dropping out due to drinking and drug use. While at TC3, Ashley rediscovered her passion for learning and transferred with her 2-year degree at SUNY Cortland for a BS in Human Services. They are currently continuing their educational journey in a master's program at SUNY Cortland while working at TC3. Ashley has presented on such topics as recovery, LGBTQIA+ issues, prevention strategies, and more at several national conferences, including the NASPA Strategies Conference. They hope to continue presenting for many more years, being the particular kind of person who really enjoys public speaking. In their free time, Ashley spends a lot of time at Cayuga Lake, paddleboarding, singing at local karaoke events, and performing in drag at regional shows. I am thrilled to present to you Ashley Dickson. The floor is yours, Ashley.
Thank you so much, Cheryl. I forgot I wrote all of that. I do enjoy all of those things very, very much. Thank you all so much for having me. I'm excited about uh, this whole thing, right? Empowering students it's kind of our jam. It's what we do as a college system, and I love everything about the work that I've had the opportunity to do in the last 6-ish years, and I'm really excited about what comes next. So we'll get right into it. So here's what I'm hoping we will have time to go over today. I want to talk a little bit about the history of Tompkins Cortland's Collegiate Recovery Program, where we started and where we are now. I want to talk about the space, which is our physical location that we have on campus. I want to talk about what recovery is, what it actually means, and how we approach it as an institution of higher education, as well as in terms of policies, laws, and regulations that we have to follow as a higher education institution. I want to talk about faculty and staff involvement. We're going to talk about the difference and the similarities between abstinence and harm reduction, as well as how that might affect the conduct process on a campus. We're going to talk about resources, both local and in terms of higher education in general. And then, of course, the most important question, the one I get the most all of the time, where does the money come from? My goal is to be done with the presentation part of this by around 12:30 so that we can get into Q&As. But as was mentioned before, please feel free to drop questions into the chat. And if I can work your question into what I'm talking about on that slide, I will absolutely do that. So our history. So I graduated from Tompkins Cortland in the spring of 2018, and I was already starting to work with our alcohol and other drug prevention coordinator at the time. Her name was Sarah Watrous. She's in this picture on the left with our former chancellor. She ran our prevention program for 5 years and um, approached me shortly after I had graduated. I had transferred to SUNY Cortland, and she said, "We have an opportunity to apply for this grant from Oasis. Are you interested in helping me write it?" And I said, "Heck yes." And we received the money in late 2018. It was a 1-year grant. And in March of 2019, we had our grand opening of our Tompkins Cortland Collegiate Recovery Program. So also in 2019, I ended up moving on campus to be a staff in residence in exchange for work as the grant inevitably started to run out. We then partnered with a Healthy Workforce grant in 2020. And then in 2021, we ended up partnering with Youth Voices Matter, which is part of Friends of Recovery New York. And then now we're here in 2024. We're hosting 5 or more meetings a week with a minimum of 1 a day. We have weekly Rec Squared events, which I will talk more about a little bit later. We have monthly outings. We have a SERPA and a SERPA P on staff. We offer one-to-one mentoring, and all of this is part of a broader step care model system that we have in place with our Health and Wellness Services department on campus. So one of our big goals as a department is that no matter where a student enters into our domain, we can get them to the person that will help them the most, as well as freely passing students around, like who can cover this part of what somebody needs, who can cover that part of what somebody needs. So we really aim to be holistic in what we do. So as I said, this first picture on the left is of Sarah at our ribbon cutting in 2019. And then this picture on the right is actually from a couple of days ago when we had our welcome back recovery luncheon for students, staff, faculty, allies, everybody who wants to come. We ended up having about 40 people. There was just simply not enough space in our space to accommodate everybody for a picture. But the young man speaking is Declan Fullerton, who is our recovery program assistant. And I dearly wanted to have him here today to talk a little bit about his experiences here, both as a student and as our recovery program assistant. But he just had a baby like literally a week ago. So we're kind of cutting him some slack and letting him spend some time with his partner and his newborn, who is adorable, can confirm. So I take lots of pictures. I'm a picture kind of person. So just some pictures of things that we've done, our team, gatherings that we've had. We've always really tried to center things that are interesting for students to do, and things that show other students how they can be involved and that they don't have to be a person in recovery to enjoy the space, to make friends in the space. So of course we have my cork board full of pictures from various events, as well as the beginning of what is now a whole wall in my current office of graduates. We take part in Stand Up for Recovery Day. This past year was our 2nd year doing it. We have students of all walks of life that spend time in the main space. That picture with the blue wall is my old office and Declan's current office. Students really love those stairs. They sit on them constantly. And then of course, this bottom left picture is our whole team for Stand Up for Recovery Day, along with our team mascot, Sully. That's the golden retriever there. He comes in twice a week and makes everybody very, very happy. I'm also seeing the mention about distance-based programs, and I will definitely speak to that, particularly when we talk about COVID, because that definitely impacted everybody. And as you can see, there are a couple of pictures where people are wearing masks. COVID definitely impacted how we interacted with students coming back, but also during it. So I will definitely speak to that a little bit. So one of the things I'm most proud of that we have is a physical location. Um, these are some older pictures. We rearrange the space pretty regularly. We like to keep it fresh. With our initial grant, we're able to purchase some really nice furniture that is held up beautifully, as well as the carpet. So we, in designing this, thought about what people in recovery need, but also what students need. And really what we landed on was coffee. Everybody wants and needs coffee. Uh, it is kind of a tradition in 12-step circles to always have coffee on hand. And that was one of our first purchases, even before the furniture, was to get a coffee pot and find somebody who was willing to donate coffee once a month so that we could have it in the space. We also, as COVID started, a little bit less than a year after we opened, we invested in Zoom, right? We knew we were going to have to anyways. It kind of came down to it between WebEx and Zoom, and nobody talks about Skype, but that really was the first. And we have our own dedicated personal private, not personal, business private Zoom that is HIPAA compliant so that we could continue to host meetings and one-on-one programs throughout that time. That is something that we don't currently do, but we do have a lot of students who live off campus and do not come to campus very often. And now we also have Teams, which we use a lot. We have a group chat for anybody who's involved in the recovery program, as well as campus groups, which is our student activities website that talks about any events that are coming up. And as much as possible, we do create events that are hybrid where people can come in on Zooms or on Zoom or on Teams to kind of participate from a distance for what's comfortable for them. So, what is recovery? So I really like to always include the SAMHSA definition of recovery whenever I talk about this. And theirs is a process of change that helps people improve their health and wellness, live independently, and reach their full potential. One of my favorite things about this definition is that it does not directly talk about substance use, right? This definition is strictly about people making behavior changes to improve their overall life. And we embrace that very, very much with our recovery program. We often have people who are like, well, I'm not in recovery from substance use, but I've had an eating disorder, or I've self-harmed in the past, or many, many other things that people can be in recovery from, right? Mental health, physical issues. People can be in recovery for so many different things. And one of the things that we champion in our program is this idea that what we really are here for is to help you make a change if that's what you want, whether that's through just having other people around you, a sense of community, a way to connect with other people, resources that are available on campus and off campus. That's really at the center of what we do. We, of course, focus on substance use. That is where I have lived experience. It's where Declan has lived experience. And it's where many of our students who are involved have lived experience. But we don't ever tell anybody what recovery should mean to them specifically. We are, myself and Declan, are CERPAs, Certified Recovery Peer Advocates, which means for us, we went through this training that taught us, and we both believe it, that you're in recovery when you say you are, right? We don't require people to define what recovery looks like for them because it can be so different for different people. What we do have are 10 components of recovery that we embrace within our program, that we stick by. And it's these that are listed. I'll read through them very quickly. Recovery is self-directed, individualized and person-centered. It's focused on empowerment. It is holistic. It is non-linear. It is strength-based, peer-supported, rooted in respect, based on responsibility, and it is about centering hope, right? Very rarely do we spend time with students saying, well, what drugs did you do? Right. And how long have you been sober? And with your recovery, what step are you on? Right. We don't do that. We focus very much on meeting the needs of individuals at the point where they are at. Meeting people where they're at is one of the most important parts of the work that we do. And it's something that we're all in the entire department, Health and Wellness Services, we're all very dedicated to that concept of letting people be the expert of their own life and tell us what they need, and we will meet those needs in whatever way possible. Faculty and staff involvement. It was mentioned earlier that we have a pretty awesome president, Dr. Amy Kremenick. She's pretty fabulous. She's been very good about being involved. Actually, so you can see the far right is our 2023 Stand Up for Recovery Day, and then the far left is our 24 Stand Up for Recovery Day. And she's so good about showing up and wearing the purple and taking the pictures and meeting with the students. And that's been really exciting. When we first opened the recovery program, we had Dr. Montague as our president at the time, and she was also very involved in approving of what we do, right? One of the most complicated things when you're running any kind of new program at a campus is having administrative buy-in. And we have been incredibly fortunate that our presidents and our administrative team, our executive teams, have been so into the idea of supporting all of our students, right? So Dr. Kremenick is amazing about showing up. When she first started, she came down to my office and we talked for an hour about why this mattered and why we were doing it here. And she left with an understanding that has led to her being deeply involved when we do things. And it's something that we appreciate very, very much as we move forward with the program. You can also see this middle picture is from the luncheon a couple of days ago, and just about everybody in that picture is a faculty or staff member, right? We have amazing turnout when we do events on the basis of, we invite faculty, staff, anybody on campus to come, regardless of their own lived experience, to show students that we are here, right? That they're not alone, regardless of what an individual's lived experience is. The people who are employed by this college are here to support every student. And we have been really blessed with a lot of people who are willing to show up and show out for our students, regardless of what that student has going on. And it's been fantastic. And also, again, I cannot state enough how popular Sullivan is on our campus. His name is Sully. I call him Sullivan. It's a thing. He's an absolute delight, and he makes people very happy. It can be really difficult to fully articulate the importance of something like a recovery program on your campus. But if you can get your administrative team, your executive team, your faculty and staff behind it, it is so powerful to be able to say that everybody here knows that this program exists and wants it to be here and supports it. And that has been really beautiful as we've experienced that. Let's talk about abstinence, harm reduction, and conduct. We talked a little bit about what the definition of recovery is and how it can be very, very different for different people. Harm reduction specifically refers to policies, programs, and practices aimed to minimize the negative impacts associated with drug use. It's also something that is a lot broader than that. It's something that I really love speaking on harm reduction because we often don't think about how many ways we already interact with harm reduction in our day-to-day lives. If you brushed your teeth this morning, you are engaged in harm reduction, right? If you wear a seatbelt when you get in your car, you are engaged with harm reduction. Anything that you do to reduce your risk of personal harm, injury, consequences is harm reduction. And it can sound really scary when we talk about it in relation to substances that we as professionals know have killed people and continue to kill people. But it goes back to those components of recovery and allowing people to have to create their own path to recovery. And it's something that we take very seriously in our recovery program, where we do not require our students to be abstinent. We do ask that any student who is in our space is willing to look at critically and explore their relationship with substances. What we found is that when you give people, anybody, the space to negotiate with themselves about their relationship with something, they will come around to a place that is healthy for them. Whether it is, an adult who's 26 years old who is realizing that they need to moderate their drinking a little bit more. So we help them find ways that they can be comfortable with their rate of use, with their level of use, right? We talk about what kind of consequences they're facing and how they can change those consequences. Or it could be somebody who is using an illicit substance and, we are never going to say, hey, don't do that. What we can say is, that's illegal, right? I'm concerned for you. I'm worried about what might happen and what consequences you might have. And in the meantime, I want you to be safe. Because more than anything, what we want for our students is for them to survive and graduate and have the life that they want. We don't get to decide what that life looks like, but we can guide them and help them and give them resources to build that life that they want. And that is something that we take very seriously on this campus. Also, some interesting things to note and add, especially as we bring in conduct to this, is that these three, Section 504 of the Rehabilitation Act, Title II of the ADA Act, and also the DFCSA are all protections for Americans with disabilities. And substance use disorder, including alcohol use disorder, are recognized as disabilities under the Americans with Disabilities Act. So it's an important thing to note because it can have an impact on your conduct process, and it can have an impact on your office for accommodations and for students with disabilities who may need specific things in the classroom or in their housing situation. So it's important to know about that and think about how you may interact with that if you are starting a recovery program on your campus. We have historically had students who were involved in the recovery program who suffered a recurrence of their use. They end up with a conduct. And while it doesn't change the fact that there are consequences, there are always consequences to our actions. What it does is it better informs how we treat that person and how we shift them to the next step. If I have a student who's actively involved and comes to all of our AA meetings, and then they get a conduct for having alcohol or being drunk on campus, then I already know that they have a need for treatment, perhaps at a higher level than a student who gets busted at a party on a Saturday night, right? So this gives us an opportunity to be better connected to our students prior to any conduct issues. It also gives us a really fantastic resource for students who have recurrent conduct issues for any substances that are not allowed on our campus. We never require people to participate in recovery program events. However, it is the kind of thing where if I also run our options program, which is similar to basics, we often refer people to it or refer people to the SERPAs or refer people to just check it out, right? Try a meeting, that sort of thing. Examples of classroom accommodations for substance use disorder, that can be tricky. SUD is usually co-occurring with anxiety and depression, so most of the accommodations that you'll see will be more along the lines of the needs for anxiety and depression. For myself, as a student in recovery who sought accommodations, I was eligible for extra test time. I did not take that. My particular brand of anxiety means that I will be done with it before everybody else, not after. But there are some people who do take advantage of extended test time. There was also things like writing assistance in terms of like a recording pen that I could take notes with and then read back. Um, I was permitted to have, I was basically, I could sit wherever I wanted in a classroom so that I could leave if I needed to. Professors were made aware that I may have to leave out of anxiety, to kind of walk in the hallway for a minute to cool down. Um, those are the kind of accommodations, mostly because they're so like they just co-occur with anxiety to such an extent. There may be some others that I am unfamiliar with. We have not had a very high percentage of our students with diagnosed SUD seek accommodations for that. More often, they have other disorders that co-occur that they seek accommodation for. Um, yeah. The options program. So this is an educational intervention that's based on motivational interviewing. You may have the basics program on your campus. Options was kind of created to be geared more towards cannabis use because that is our number one, even over alcohol on our campus. Um, but what it basically is a student gets caught and they get sent to me and they sit in my office and we have 30 minutes to an hour where we mostly talk about what's going on in their life, where they're at, and how their substance use may have led them to be sitting in my office instead of having a good time with their friends. Very similar to the way we view harm reduction and the peer approach model that we use is most often the question I ask is, how's that working for you? Um, if somebody comes in and says, I don't have a problem, I'm like, okay, you're sitting in my office because something happened. Doesn't feel like something you would choose to do. So how did that happen, right? What happened to get there? And how is that impacting your life? Is that a positive thing? Do you want to be in here every week for the rest of the semester to talk to me? You're welcome to, but do you want to? Things like that to get students to kind of think about the choices they're making for themselves, right? We also just recently, we're one of the few community colleges that has on-campus housing. We have 4 dorms that are functional right now with approximately 360 students, I believe. Um, give or take. And we have begun using living learning communities on our campus. So we just started a recovery living learning community that is, I'm still staff and residence. So I live on one of the floors. There are 2 4-bedroom suites adjacent to mine. We do not have a high number of students at this moment, but that is something that is growing. This is the first semester that we've had it. And we have 2 students that chose to live in it. So that is something that may grow even into the next semester as students become aware that that is an option that they can choose. Resources in your local community. So we work with a lot of people. You're also seeing some pretty awesome pictures right now. We do a lot with organizations that exist in our area. Again, we're a community college. We're very closely tied to our local community in both Cortland County and Tompkins County. So we host events where we invite people from tons of different organizations to come and get involved in the work we do. We have an annual event called Celebrate Life that is a combination between substance use recovery and suicide prevention. There's a lot of overlap in substance use world and suicide world. So when it comes to prevention, we like to team up with them. We have local hospitals, local inpatients, local outpatients, as well as primary care. I believe this woman is from a local hospital system that we have, Guthrie, and I could be very wrong, but I think that's her. This is from a couple of years ago. And we basically fill the hallway, right? And these are also organizations that are aware of the recovery space and what we do. And if they have somebody come in who's interested in going back to school and getting their degree, but they're not sure where to start and they have, a substance use disorder, they're early in recovery. This gives us an extra way to refer students to us for anything people might need. We also have teamed up with our local community recovery center, Ithaca Community Recovery, also known as 518. That's that center top picture. That is myself, 2 colleagues, and a student. We jumped into Cayuga Lake on January 1st to raise money. It was horrible. It was one of the coolest things I've ever done, and I'm never doing it again. We picked an 80s theme. We all dressed up, and then we jumped into the lake to go fetch a balloon to raise money for the Ithaca Community Recovery Program, which is a place where many, many, many people have found recovery. So we like to support them. We're also partnered with a local opioid overdose prevention program. So we have Narcan on campus. I'm certified to be a Narcan trainer, so I offer Narcan trainings pretty consistently throughout the year. The most recent one was this past Wednesday. I gave out 50 kits. We had a really good showing of people, and a bunch of people wanted extras, which feels really good. Narcan recovery and substance use prevention are very closely tied. So we always keep Narcan on hand. I think you'd be hard pressed to find a department on this campus that doesn't at the minimum know what Narcan is, if not have it with them. And then of course we also partner with other organizations that focus on overdose prevention and awareness around substance use disorders. This is a photo from a couple of years ago in the same shirt at an overdose event where I spoke about overdose, the opioid epidemic, and the importance of recovery resources in a community. And that was a very deeply meaningful thing. I can't believe I put that picture up here. I was crying very, very hard at that one. That was a rough one. Higher education resources. So the biggest one is the Association of Recovery in Higher Education, also known as ARHE. This photo on the left is myself. You might recognize Declan. That's when he was still a student here. And then a couple of students from another school, one of my students, Mel, and then a couple of staff members from, I believe that was University of South Carolina. So ARHE has an annual conference that jumps around different places in the country. I dream of having it held in New York sometime. I think it'd be very, very cool to have them come to TC3 or to another college to do this. It's a 3-day conference where students, faculty, staff are welcome to come, and we talk about recovery in higher education and how we're supporting our students and what programs are working and the intersections that we are facing, whether it's with students of color or queer students, any other marginalized groups that we're working with, and what has worked and what hasn't, right? And we trade stories, and we eat a lot of really good food, and there's this beautiful, enormous sense of community because everybody there loves and supports recovery and what it can mean for people. It's a very powerful experience. There's also within our own state and within your own campuses, there are places that you can partner with, right? Youth Voices Matter, as I mentioned at the beginning, is part of Friends of Recovery New York. They're a nonprofit that is tasked with supporting recovery in New York State. They've been an amazing resource for us. They offer trainings. They actually partnered and gave us money for several years in a row. We're coming to the end of that, but there's exciting news at the end of that. The very last slide is where's the money come from, and then I'll open up for questions. But also little things, right? Our bookstore on campus is willing to support us, right? They're willing to, this is actually a gift basket from a couple of years ago where they gave us vouchers to give our students a product from the bookstore, right? We of course reimbursed them afterwards, but they were willing to partner with us on this, which can be something that's very hard to find on a campus. And one of the things we found is if you don't ask, you don't get it. We've had really good success with partnering with adjacent agencies that work on our campus. Same with our food services. Yeah. All right, where does the money come from? The most frustrating part of this, as we were building this program through the years, was every time somebody would say, "Oh, everybody should have a collegiate recovery program. You just got to do it." Right? Cool. Where's the money come from? And then people are like, "Well, it's about relationship building and you have to know who to talk to, and like everybody has a network and you probably know somebody, right? And there are partners within the state and there are community partners and there are grants, both state and national." That doesn't actually talk about where you get the money, right? And if I sit through one more thing that says just do a fundraiser, I'm going to scream. Um, our recovery program operates on a budget of roughly $50,000 a year, give or take. Our recovery program assistant is a part-time person who is making less than $25 an hour. My coordinator position is not currently paid. It is part of other duties as assigned. We have tightened the belt over the years, right? Our first grant from Oasis, we were one of 5 SUNY recipients. The other 4 were Corning Community College, Onondaga, believe SUNY Purchase, and SUNY Albany. The community colleges, the 3 of us, we received $20,000 for a year. And that allowed us to hire 2 recovery program specialists through September of 2019, and it bought us furniture. And those specialist positions were stipend, very limited dollar amount, and we did what we could with what we had. Part of this has been finding people who are dedicated, who are willing to put a little front end labor in for some back end payment, which is hard and not something that's easy to ask somebody to do. I happened to come into this with a ton of passion and also working on a degree. So I had student loans coming in. So I was a little bit better supported than another person you may hire. But moving to on-campus housing in exchange for work was a big part of how we kept the recovery program going. In 2020, when we partnered with that local healthy workforce grant, we had a 1-year contract with them where they gave us around $60,000 to $70,000 that included a full-time position for that year. That was wonderful, and it also included sending me to Connecticut to get the trainer for the SERPA positions. That was only a 1-year thing. And then of course, COVID is happening, lots of living on campus and hoping for grants to come up and stipend situations. But then in 2021, we were approached by Youth Voices Matter, and they offered us a modest budget to operate, and we've been working with them since. They have given us money annually to support 1 paid position that is part-time, as well as a budget to run things like our Rec Squared program, which again, I will talk about shortly. And that has been the big thing, right? We've been going grant to grant to grant and partnership to partnership since 2018, roughly. And that's hard, right? It's been very, very difficult. The most exciting thing is this year we were approved to be part of the annual college budget. For about $15,000. So we are able to keep a part-time person. And we also just recently received the SUNY Mental Health Award, that recurring annual thing. So we are able to have a little bit more income from that as well, which will further boost what we can do with the budget that we have. But I'm not gonna lie, it's hard, right? It's very, very, very much going from grant to grant and holding your breath and hoping you get it until you can be on the college budget. It is my dream, and this is a bold thing for me to say on a SUNY call. It's my dream for SUNY to decide that every college should have a recovery program, and then also gives money to every college to have a collegiate recovery program. There's a lot of evidence that recovery programs not only help with retention, but because they help with retention, they save a ton of money for schools. So each student who's a part of the recovery space, the recovery program is actually generating income for the college because of their presence and their likelihood of bringing other people in, which has been a beautiful thing. The last thing I want to talk about, and it's really more me just showing off, is because we've had a very healthy budget the last few years working with Youth Voices Matter, we've been able to do this amazing program called Rec Squared, which is recovery and recreation. We're partnered with our recreation department, and basically they pick a cool thing they want to do that our students wouldn't normally be able to do, and we pay for it. So we have sent students horseback riding. We've done paintball. We do weekly bowling trips. We've also done ski trips in the winter. We've done so much paintball. Everybody loves paintball. We did trap shooting. We're doing that again this semester. There are many students who have never been in the countryside before. So teaching them firearm safety and giving them the ability to try something new that they normally wouldn't be able to do has been really, really beautiful. And then we also have done canoe trips. We have so many more things planned for this fall. I know we have trap shooting coming up. I have to look at my list. It's somewhere. Um, but we just keep coming up with fun things that our students may not have access to or would not normally be able to afford to do. And we fund it, right? Because every student deserves to have access to these things. And all of these activities are substance free, right? We are sending people out on a Sunday afternoon. You have to, to go out and do something. And we've had some really amazing results from that, of having students come out and learn new things and have a good time. This is my last slide. Contact info. I'm going to leave this one up during the Q&A section so that you have the resources on the screen. Like I said, Declan is our recovery program assistant. He is our main point of contact for our recovery program at this stage. So please feel free to email him. He does have a newborn, but he's doing pretty good with responding to emails. I actually need to text him and tell him to stop. He has a baby, time to focus. And then, of course, my contact information is up here. I've also included links to the Association of Recovery and Higher Education, Friends of Recovery New York, Youth Voices Matter, Ithaca Community Recovery, Rural Health Institute, whom I have not mentioned directly, but they help us a lot with our data coordination and supporting things that we do. And they are also the opioid overdose prevention program that we work with that gives us Narcan. And Access to Independence Cortland is a disability specific organization in Cortland that has helped us a lot with understanding substance use disorder as a disability and how that might impact our students. And then, of course, my office has moved since I am no longer in the recovery program, but the students have followed me. They are still pretty consistently in my office, and I love showing them off. So here's a group of my boys. Somehow I accidentally adopted the entire lacrosse team about 2 years ago. Declan was the goalie when he was still a student, and now I am still team mom. So one of the odd things that's happened through this amazing life that I've had the last 6 years running the recovery program. That is all I have in terms of sharing directly. I talked for way longer than I meant to, but I am totally open for questions.
We do have a couple that were in the chat. I know you saw the first one from Diana. I don't know if you have anything more to add to that. We also had a question from MM Detour at Onondaga. What are examples of classroom accommodations for substance abuse disorder?
Yeah, absolutely. Let me make sure that I'm, yep. So yeah, just to expand on that a little bit more, like I said, substance use disorder is usually co-occurring with other issues like anxiety and depression. Substance use disorder is also part of obsessive compulsive. So it can be really difficult to manage being in a classroom. So that's another thing that you may see, particularly if you're involved in the ADA office on your campus, is students who are seeking specifically online classes or who are seeking specifically modes of education. So that's something to be on the lookout for, absolutely.
Folks want to unmute. Oh, good. Go ahead.
Good afternoon, Ashley. My name is Tour Orange from FIT in New York City. And thank you for your good work. That's first and foremost. My question is, did the issue or the problems present themselves and you then crafted something in response to what you saw? Or did you craft something proactively and the students then came?
Thank you, Tor, for that question. That's an excellent question. It's actually something I just recently spoke to with our students on campus at that luncheon, is that the answer to that question is kind of both. So I myself am a person in long-term recovery. I came to TC3 as an 18-year-old. I did not have a good time. I spent 10 years or so trying to figure myself out, mostly with drugs and alcohol, and it didn't work. And I came back to TC3 as an adult student in recovery. And I did not have the resources that I needed. I managed to be a very effective student. I was excellent at that. I did not have any community when I was on campus, and that was very frustrating for me. I really wanted other people that weren't following that like college life kind of concept, which is already not as real. We know that our students aren't really doing the whole American Pie thing anymore, right? They're much tamer. But I didn't want the party every weekend kind of lifestyle. And so we have worked towards creating this program partially because we knew the students were here, right? I was a student in recovery when when we started talking about creating this program, and we knew I wasn't the only one. So we very much started building it proactively, knowing that there were already people who were invested in creating it. In terms of creating it on a campus, it is always easier if you have a group of students behind it because people listen when the students want something. But in this case, it is very much an if you build it, they will come kind of situation, which can be hard to bring to a finance board specifically. But I promise you have students in recovery on your campus, guaranteed. Yeah. I hope that answered your question, Tor.
Yes, thank you.
Mhm.
I actually had this. Oh, I'm sorry.
I also see in the chat, how do you feel about academic advisors having some form of addiction certification like KSAC, SERPA, or prevention? I think that is beautiful. I think that's an awful lot to ask of your academic advisors. I know on our campus, our academic advisors are all full-time professors, and they're teaching 6+ classes, and asking them to do an additional certification process is an awful lot to ask of anybody. I do think there are certainly trainings that are available for being an ally in recovery, and trainings around mental health and kind of understanding the needs of students with disabilities. I think those trainings are very, very valuable because we don't need our advisors to know everything about one thing. We need them to know a lot about most things. So that's where those trainings really come in handy. In the same way that you would like have a training around gender and sexuality, right? So that everybody is gendering people correctly and helping people with name change forms as needed, right? In the same way that you would want them to know a little bit about the athletic process at your school in case they're involved in athletics, so that when they say, hey, I need to miss a class on Wednesdays, that advisor can say, well, we shouldn't schedule you in a class on Wednesdays, that sort of thing. So I do highly recommend having, if you have clinical mental health counseling on your campus, I highly, highly, highly recommend having a KSAC, somebody who has gone through the KSAC certification process. And having Serpas or peers in general is always going to be a good thing. Peers have that lived experience that can make them very helpful. And you can also create that with your students as well. We have at least 4 students that I can think of right off the top of my head who are trained without certification in being peers, and they do an amazing job working with students who come into the space. They make people feel comfortable and at home, and they give them the resources they need without being an authority figure, and that's been really positive. And every college should have a prevention person.
Anyone else have any questions they'd like to put in the chat, or go ahead and unmute? And oh, one more.
Okay. Are students able to come to the college health office for any meds needed once they have identified as a recovery individual? It depends on what we're talking about here. Our campus does not have the ability to prescribe. So we do not give out medication other than you have a headache. There's some options on the wall if you want ibuprofen or Aleve or whatever. We certainly refer people to primary care and other places as needed. We also have a partnership with our local drugstore to have medication delivered. So, you know, if getting your meds at school is more helpful, you can have it delivered to our health office, then you can pick up your medication. If you're talking about in terms of something like methadone or Suboxone, that is something that we have not done at this stage. However, we are partnered, like I said, with a couple of local inpatient and outpatient resources where if I had a student who said, I need to get methadone every day, but I don't have a way to get to the clinic, that's something that we could find an accommodation for, whether it's having somebody bring the van that the methadone clinic has to campus so that they can get their dose, or if we help them with a Medicab, things like that are things that we do quite often on campus. But we do not hold any medication to dispense to people.
I have another question. My name is Corina, and I'm here with FIT at EOP. And my question is, if a student goes into relapse and they need to go in an inpatient facility, what will happen with his semester? Will the whatever work the professors are asking from him, will this work will be delivered to them so they will not lose the semester, or will they just simply lose the semester?
Excellent question. Thank you. So when a student has a recurrence and needs to get treatment, our first priority is always going to be to get them into treatment. This is another great benefit of having a step care model in our health and wellness department. Is this happened last semester. Declan came to me, said, I have a student who needs to go to rehab. And I said, cool, let's get that student into rehab. And we did. And then the next step was going to our caseworker and saying, this student just went to rehab. We need to start working on the medical withdrawal form. So we were able to do that. And then it was a matter of like making sure that the correct paperwork was emailed to the student before they entered the facility so that they could sign what needed to be signed and then send it back to us. And we handled all of it on the back end, which means that this student was really, they were done with their program and they were then eligible to re-enroll. We do sometimes, when a student is medically withdrawn, ask that they fulfill certain like check boxes, like do you have a treatment plan, do you have a provider, things like that. And it's very case by case, right? So if a student is less willing about being medically withdrawn or sent to a facility, then we'll have a much bigger list of like, what is your care plan? Who is your support, right? Like what Medicaid, they'll have a much closer relationship with our caseworker and our clinician. But if somebody does need to take a medical leave to deal with their substance use disorder in any way, we do that medical withdrawal so that they can then return when they are ready, to be better taken care of. I hope that answers your question. And I saw one more question, and I also know that we only have 3 minutes left. So how do you support students who have a family member in active addiction or looking to be in recovery? We love working with people who love people that are in recovery. We provide Al-Anon meetings, we provide harm reduction meetings, we have AA and NA meetings, and we're pretty much open to any other meeting somebody might want. So we've had people ask if we offer adult children of alcoholics meetings. That's something that we're willing to do. Al-Anon also falls in really close with that. So we always emphasize when we do events and when we do Al-Anon meetings specifically that allies are welcome, right? We want you there. We want you there to reduce the stigma of people using a recovery space. We want you there to show that people can love people in recovery, or people can love people who are in active addiction, right? And that those supports exist, and we will do everything we can to meet their needs as well. And people who are sober curious, I guess, is the common way of saying that. They're also always welcome, right? Like I said, we never require people to be a certain amount of sober or a certain type of sober to participate in our program. We just don't want them to be actively high while they're in our space. and we want them to be willing to have that conversation with themselves, right? Like, where are you at? And how comfortable are you? Will you advocate in front of a judge for the students to go into inpatient versus jail? So if someone gets in trouble with the law, yes, absolutely. That is something I would be willing to do. Primarily, I'm more of a letter writer. That is the most common thing I've gotten is requests for letters saying like, hey, this person has been in recovery, has been involved in the space, and needs this resource, as opposed to being sent to some form of incarceration. I've also worked with people who are incarcerated and are in college, and often what that turns into is a letter to usually Oasis saying, please give this person their certification because they've been so good about recovery and about the work that they're doing and all of that. So that's absolutely something that we do. Anybody in my department would absolutely be willing to write letters or make a phone call if needed for students who have been active in their recovery journey.
Ashley, thank you so much for sharing your time and your expertise with us. This was so informative. I think we've all walked away with so much more information to be able to better empower our students. Those of you who've joined the workshop, the webinar, the information will be posted on the CPD website. The PowerPoint will be shared. And Ashley, thank you again for sharing additional resources. You are welcome to come back again. This was great. Thank you all. There's actually a note in the chat from Jennifer Schneider letting us know that the workshop originally scheduled for October 4th, which will focus on supporting undocumented students, has been moved to December 6th. So please make a note of that. If you are planning to attend that workshop, it is now going to be on December 6th. So our next Empowering Every Student webinar will be on October 18th. Thank you all again. And Ashley, we really appreciate your advocacy on behalf of our students.
Thank you so much for having me. This is a pleasure.